So now, let's talk about the anatomy of a tooth. This is what you see, okay? But there's a lot more going on to a tooth than that. The most important thing is recognizing that these teeth in our mouth connect to our body, okay? So let me just talk about this. The outside of your tooth has enamel. Inside there's dentin, okay? Then it goes to the pulp, okay? That's the inside of the tooth. So the enamel is the stuff you see on the outside, the dentin is underneath, and then the pulp is inside. Our teeth have veins or nerves and blood flow into the teeth, okay? So there's blood going in all the time to keep these teeth healthy. Then the gums are what's around the tooth, okay? And then they're in bone. So each one of these has all this going on. When we get a cavity, which I'm going to go into, when we need a root canal, when we have things that are happening, they happen into different parts of these teeth. So it's important to know the different parts and how urgent the treatment is, or how important the treatment is, because the deeper it goes into the tooth, the bigger of an issue it is. So if I just chip the enamel, that's annoying. Maybe it messed up my smile. Maybe it doesn't look great. Maybe it rubs on my tongue and it hurts a little bit. But that's not as urgent as it's now into the pulp cavity, and it's going into my body. I have an active decay deeper into the tooth, okay? So the deeper it goes, the more urgent it is. And this is important because as you learn how to talk to patients about treatment, as you learn how to determine if it's an emergency or not, if they should get scheduled in right away or not, you're going to want to learn more about this, okay? Or you're going to learn more about this. Now, we have the gums. That's what we can see right here, right? And then there's the bone. Our teeth are in bone. That's what keeps them in our mouth. God, I really feel like I'm learning. Like, this is like Sesame Street, right? Teaching you all about your mouth. So the bone is what holds the teeth in, okay? And then the gums that are around the outside. This is the basic anatomy of a tooth. Now, see the veins and blood and vessels right there? That goes into our body. All of this bone is part of your body. So I'm going to teach you in a little bit about infections. When we have an infection down in the bone or down in the roots, guess where it's going? Into our body, into our heart, into so many other things that help us be healthy or not. So this is why it's important that we understand why we need to take care of our teeth, because all of this connects to our body. And that is where our job is as healthcare professionals, to remind our patients it's not just about the smile. Yes, we want your smile to be great. Yes, we want to fix that Grand Canyon in your mouth and replace it so that you can chew. But also at the end of the day, we want to make sure that you're stable and healthy, like we talked about earlier on. We want to make sure that you understand what we do in our office helps your overall health. Okay, so again, here's the surfaces of the teeth, okay? So we talked about numbers. Now, we have surfaces. Surfaces are how we talk about which part of the tooth. So imagine a tooth being like a box, okay? Each side of the box has a name, has a surface, okay? And we use these words because if I say the top of the tooth, the front of the tooth, the back of the tooth, the side of the tooth, we're all going to talk about different things, okay? So we're talking about thinking about different areas. So the buccal is the surface closest to the cheek, okay? And when I wrote this, I'm just going to put it out there right now, I said closest to the cheek. I couldn't even leave it on there. I had to fix it last minute. So that's supposed to say cheek, not chick. It's not closest to the cheek. Okay, so your buccal is the side closest to the cheek. Your distal is the surface going away from the midline. So remember, the midline's here. So all the, I'm going to say backs, right? Because all the backs of the teeth going away from the midline is your distal, okay? The facial is the face, it's the surface that faces the cheeks or the lips. So the cheeks or the lips, okay? So the front right here, okay? Look at, I'm doing all of this. This is going to be really good for social media. The incisal is the biting edge of the anterior teeth. So the front teeth, what we bite with, I'm biting my finger right now, is the incisal edge, okay? The labial is the surface towards the lips. The lingual is the surface that faces the tongue. The mesial is the surface that's closest to the midline of the face, so not the back now, but the front going towards the midline. The occlusal, we already talked about this, it's the chewing surface on the back teeth, okay? And the proximal is the two surfaces that are next to each other. So if I've got a cavity, it's a proximal cavity, it's going to be between, right? When I'm describing where the cavity is, it's going to be between the teeth. When we floss, that's between the teeth, okay? Again, you can see, I don't know all of these off the top of my head. It's okay, because in my practice management software, I can see where a filling is, and it tells me it's an MOD. I know it's a mesial, occlusal, distal. If it's a lingual, it says lingual, right? Like the pictures are there for us non-clinical people, but it's important that you know this. And if you are going to be a floater, if you are going to be a dental assistant, if you are going to be in the back working with the doctor, you are going to need to know this, because when the doctor says, we need to look at the buccal of tooth number whatever, you better not have to go to a picture in your book to come back and look at the buccal. So you are going to want to learn this. But for those of us in the front, don't freak. You can use your cheat sheets, and eventually you're probably smarter than me. You'll have it memorized and you'll be much better at it. Okay? So again, here's your surfaces. All right, distal, facial, occlusal, mesial, and lingual. If you want, definitely go out and write more notes for yourself, draw pictures, draw arrows, whatever you need to do to get this to stick for you. But once you get it and you understand that every tooth has a number, every tooth has a surface, and there's an area in the mouth in which the tooth lives, you've got it. You've got what you need.